Please tell us your name.
Tom Jenkins.
And Tom, what brought you to Kentuckiana Integrative Medicine?
Well, I was diagnosed with prostate cancer, and they had thought it had spread to the bone, and there was lesions, and so we had done some research. Me and my fiance, girlfriend, and I guess fiance now, had done some research, and it looked like high-dose vitamin C was. They were doing that. It looked like in Mexico, and she did some more research and found out that they were doing it here, and that's what led me here. She got you guys off the website, and I started treatments. I believe you had mentioned that it. I think at Reardon they said twice a week,
Mm-hmm.
and that's what I started out with, twice a week IVs, and. So since then, I've gone back to have, I went down to MD Anderson because we were just getting, all through this I stayed with the IV treatment, but we were getting conflicting results from different doctors, and Jennifer suggested we go to out of town and get an opinion from either the Cleveland Clinic or MD Anderson, and MD Anderson responded back first, and we made an appointment to go there. They wanted to do a lot of different tests. They wanted to do the MRI with the probe, and they wanted to do a bone scan, and they wanted to do a CT scan, and they ran all three. And so we went down there, and they ran all three, and they said they couldn't because they wanted to find out. They wanted to biopsy some more lesions, and I guess we had gone down there. I don't know if you remember, but I'm not clear on the timeline, but it was after, maybe about 6 months after I started treatments here.
Mm-hmm. I think it was more like 9.
Maybe 9.
You were very aggressive here.
Yeah, twice a week. And we went down there and had all three. We had the MRI with the probe and the CT scan and the bone scan, and they couldn't find anything else to biopsy on the bone or anything like that. So at that point, I guess it had changed. The treatment, their treatment suggests they had also, I don't know if it makes any difference, but they had also upgrade. I got a Gleason score of 6 in Louisville when they did the biopsy back in 2014, and they took that same pathology and came up with a Gleason score of 7. So they wanted to start treatments right away, and they thought, well, on that trip down, that the best course of action was to do either radiation or prostatectomy. And I came back here, and I was pretty much set on going back to MD Anderson for the prostatectomy, and that's the way I decided to go. But some friends, and then I think you, Dr. Cruz, and some other doctors that I know has suggested Dr. Bell here in Louisville, part of First Urology, and I met with him, and Jennifer did too, and he was probably one of the most personable doctors that we met, and he seemed to know more than most, and he said that he would put his experience and skill up against anybody at MD Anderson, and that made sense. And a friend of mine who was a surgeon said, if you're going to do it here in case you have complications. It's better to be local, and I agreed. And I probably would have chosen Dr. Bell anyway, even if he just over MD Anderson anyway, even if the geography wasn't a factor. We just liked him that much. And had surgery there on June 20th of this year, and I had my first follow-up PSA about 3 months ago, and the PSA was below 1. It was healing pretty quickly, and I guess I've got another follow-up coming up on the 16th. He was pleased with everything. The healing went pretty fast. Actually really fast, and don't notice a lot of difference other than maybe a few side effects still.
what were you doing before you came to us in terms of treating the cancer?
In terms of treating the cancer, I was, they had put me on, like I said, they had found lesions on the bone. So Dr. Montez, who's part of Baptist, had put me on the hormone therapy. I forgot what it's called.
Mm-hmm.
But it suppresses suppresses the testosterone.
And you continued that the entire time, correct?
I only did one treatment of that.
Okay. So you stopped after one treatment because you felt really tired, or?
No, I was going to continue, but in the interim, we had gone down to MD Anderson, I think, or made plans to go, and they wanted me not to do it before I came, and the treatments last for 3 months, so I was still in that cycle. I was coming up on the second treatment, and had contacted MD Anderson during that time, and they said that they wanted me not to take that treatment before I had the test done down there in Texas.
Okay. And what was your highest PSA? Do you remember?
I think it was just over 6.
Okay. And before you, or when they tested it at MD Anderson, before your surgery, how high was it? Do you remember?
About the same,
6.
maybe a couple of points higher.
Okay. So basically, your story is, in summary, is a guy who had prostate cancer with bone metastasis, and in several spots. Do you remember where the lesions were?
On the pelvis and the back, near the, just right around the pelvis area.
So when we first met Mr. Jenkins, he was feeling pretty down about his situation, and he had canceled his marriage plans. Then he got really aggressive with IVs and was doing it twice a week. Then he went to MD Anderson, and they scanned him head to toe and found no bone cancer, which allowed him to come back to Louisville and get treated by Dr. Bell, who's an expert at Da Vinci laparoscopic prostate removal. He's done more than practically anybody in Kentuckiana, and with a PSA less than 1 and no bony lesions, Mr. Jenkins can be considered cured. So he also made a lot of lifestyle changes, which he didn't mention, but do you want to talk about?
Sure. Yeah, I changed that. I attribute that as well. One of the things, before I even had this surgery, my father was diagnosed with prostate cancer also when he was in his 50s, I think, and he's 87 now. But he had done a lot of research on diet, and that's what he kind of does for a living. And so he came up with a diet, and I had been on the diet for about a month. So even before I had the surgery, my PSA had gone down, I think, to around 4 in just a month or two on that diet. And it's plant-based, so it's pretty much vegan, and I adhere to that. I've cut out all processed sugar for the most part, maybe once in a while, but very seldom.
So is your opinion that diet is a powerful tool in fighting cancer?
In my opinion, it is a very powerful tool in fighting cancer.
I agree with you. So Mr. Jenkins is a great example of combining, the natural therapies of IV ozone and IV vitamin C, along with conventional care, and he's accomplished a cure, and you can see he looks very healthy. He's a workaholic. He does multiple things throughout his day. Now that he's been declared cured by his urologist, probably in the next year, I think Mr. Jenkins is going to marry the same girl that's stuck with him throughout this whole episode. So is it all right if we put this video on the internet?
Sure, absolutely.
Great. We appreciate it because you're giving a lot of people hope, and a lot of people feel hopeless when they get the diagnosis of cancer. So thank you very much.
You're welcome.